COVID-19 next, as we switch our focus there. Some effective treatments for COVID-19 do not seem to be reaching Canadians, and that is specifically Paxlovid, an antiviral drug approved in this country back in January, but there are still hundreds of thousands of doses on pharmacy shelves across the country. Mike Crawley has been looking into this, and he's with us live this morning. Mike, tell us more. I've been reading your report up on CBCNews.ca. It's a very interesting one. How much Paxlovid has been distributed across the country, and then of that, how much has been actually used?
Yeah, well, Heather, I contacted every provincial health ministry to ask them those questions, and all of the provinces except Ontario responded with some numbers. And in the other 9 provinces, if you combine them, they've used roughly 15%, or a little less than 15% of their supply of Paxlovid. So yeah, this means enough medication to treat hundreds of thousands of people is sitting in warehouses or on shelves. Paxlovid it's a combination of pills that people take at home in the first few days after showing COVID symptoms, and it's designed for people who are most at risk of getting severely ill from COVID. So typically older people or people with weakened immune systems, and it's been shown to reduce hospitalization among seniors by 90%.
We know there's a bed crunch on the wards. Any person we can prevent from landing in one of these healthcare beds that can have an outcome that doesn't require oxygen, that doesn't require an intensive care stay, that doesn't require healthcare utilization is a win for the system. And the drug is here. It's not as if this is going to be an expense.
And Dr. Chagla told me that he is seeing people ending up in hospital who could have benefited from Paxlovid.
So what's the problem, Mike, then? Why has so little been dispensed in the country?
So a key factor, Heather, is about awareness, that a lot of people simply don't know that there's a medication out there that they can use to be treated with COVID, that they can, take at home. People typically think that when they get COVID, they need to just suffer it out at home and wait until they get better. And that's fine for somebody who's young and healthy, but maybe not so for seniors. Because if you wait too long to take Paxlovid, it simply doesn't work. You have to start it within 5 days of showing symptoms. And back at the beginning, the Paxlovid access was pretty restricted by the provinces. So a lot of people just, wrote it off. But now the supply is quite substantial, and the provinces have broadened their eligibility, roughly speaking. It varies from province to province, but typically if you're a senior or if you're immune compromised, you're eligible for Paxlovid. The age cutoff, in some places it's 60, in some places it's 70, but generally targeted towards older people.
So when you speak to people like Dr. Chagla, Mike, and other experts, what do they think should be done to make sure more Canadians could benefit from this medication?
Yeah, so first of all, boosting that awareness with something in the way of a publicity campaign, but also making it easier to access it during that 5-day window. Obviously, you have to get a prescription, and that's really important because Paxlovid can interact quite badly with other medications. But one way to speed up the process is in some provinces, they actually allow pharmacists to prescribe it directly. And so that avoids the need for people to have to take the time to find a doctor's appointment.
Mike, thank you very much. And again, CBCNews.ca if you want to read more about Mike's reporting on